Alright, I am Tyler Van Winkle. I'm going to do the final checkoff for Auscultation. First, I will verify, interpret, and evaluate the physician's order and protocol. I will look for any pertinent information in the chart that I need to know. I will wash and disinfect my hands. I will gather all the equipment that will be needed and verify the functions. I will check the equipment for any malfunctions. I will apply any PPE for special precautions before I enter the room. Then I will identify the patient and make sure they are correct. I will introduce myself as well as my department. I will then explain the procedure to the patient and make sure, verify that they understand what I am doing and why. I then will position the patient in the correct position and start the assessment. So for osculations, I'm going to use my stethoscope. The first part, I need to make sure it's clean. I need to clean everything with alcohol wipes. After I have cleaned everything with alcohol wipes, I'll make sure to place the stethoscope on correctly, with it facing forward on the earpieces there. I then will warm the hit the stethoscope, testing it, and I'll also warm the stethoscope or the diaphragm, test the diaphragm and warm the diaphragm before placing it on the patients. As I'm doing this, I want to make sure the patient is put properly into position. So for this, if they are able to sit, we'll have them sit up, and then you will do test them in 6 areas on the anterior chest, bilaterally listen to both lung sounds. And then you will go to the lateral side and test on the lateral side, and then you'll do the posterior chest 6 places, doing it bilaterally, listen bilaterally. If the patient is unable to sit up while they're laying down, you'll do the front chest and the lateral, and then you'll have somebody help turn to do the 6 positions on the back bilaterally and have them hold while they're on their side in the bed. After this, I will correctly interpret the different breath sounds, seeing if there's anything different or crazy in a way. And then I'll kind of do the follow-up steps. I will make sure I don't have to, or make sure if I have to, I'll reassess or re-instruct the patient on what to do. After that, I will make sure the patient remains the comfort and safety of the patient. I will get my equipment and everything that I have used. I will make sure I dispose of any items that may have been contaminated and wash my hands. I will then go and chart everything in the charts, any data that I collected, and also after I do that, make sure I report the findings to anybody, whether it be a nurse, a doctor, to see if there's any recommendations or anything about the therapy. That is it.